5th November 2019. A 1-year-old female cat is brought in with lesions on all 4 of its limbs, especially on the 2 hind legs. On the left side, there are 3 lesions all over the leg, and on the right, there is 1 patch of about 6 lesions in the same region, the upper part of the cat's leg. These lesions range from many sizes, such as 2 mm to 1.5 cm, and many of these abrasions are circular in shape and red in color, and some are full of pus. Pus is the accumulation of dead white blood cells under the surface of an infection. Before we begin, this video is a Be Kind to Pets veterinary educational video sponsored by Toa Payoh Vets and is set in Singapore. Today, the cat was brought in initially to be spayed, but we realized that she was on heat and her skin condition was not good, so the main focus was to treat her skin wounds that had only been noticed recently. The cause of these lesions is unknown, but there are a few possible causes. Apart from the lesions observed, the cat is behaving usually, eating normally, and has not been vomiting or having diarrhea. Firstly, it could be an inflicted injury. This cat lives with 2 other cats in the apartment, both of which are male full-grown cats and are older than this female cat. Hence, this may be a case of bullying, as the wounds may be from fights with other cats and are circular, such as bite marks from incisors. However, they do not share the litter box, so they would not be fighting over space, but rather it would be a case of bullying. The other cats are also neutered, so it would not be a mating case where males are aggressive as they want to mate. Secondly, the wounds may be from chemical injury, where the detergent used in the house is too strong and causes a wound on the skin of the cat. However, if it were chemical wounds, the wounds would not likely all be circular in shape and pus-filled. The lesions may be caused by bacterial or fungal infections, or lastly from an allergic reaction that the cat has faced. The owner predicted that the cat may be allergic to furniture or things in his house, and that reaction may be what caused the lesions on the skin of the cats. Therefore, I believe that the cat was injured when fighting with other cats, or it had an allergic reaction with something in its house, which caused the lesions to break out. Some allergy tests can be carried out to find out the cause of these wounds. Firstly, for allergy tests, there is intradermal skin testing or serum allergy testing that can be carried out to determine the allergen that is causing the lesions. Additionally, fungal or bacterial tests may also be carried out to see if it was due to bacteria or fungus that the wounds were caused. There is a possibility that the lesions are due to a ringworm infection, and to test this, a sample from the cat's wound must be tested with a ringworm culture to determine if it is present. Ringworm is a fungal skin infection that is contagious, but the owner and other cats do not seem to have contracted it. In conclusion, the cat's wounds were treated with anti-inflammatory medicine, antiseptics, and antibiotics to help the wounds heal. There will be a test carried out with the ringworm culture to determine if ringworm is the cause of these lesions. Cat owners, my advice is to make sure nothing in your home poses harm to your cats. It is important to make sure the detergent used is non-harmful, and that once an allergy is spotted, it must be tested to find the issue immediately and remove it so it no longer affects the cats. If any lesions are spotted, it may be bacterial or fungal infections and should also be treated quickly before it is contaminated to anyone else.